a parent, there's really nothing worse than a sick child, especially a chronic or ongoing disease.
Next week, our partners at Spectrum Health Medical Group are having a free seminar where parents can find out more.
And Dr. Daniel Arndt is here with us today. We're talking about something that I think is going to be a learning experience for both Terry and I about parenting a child that has epilepsy. And parenting itself is not easy, but...
No, it's not. Yeah.
You know, talk about, what this is like and how you're able to kind of help along, educate, that sort of thing.
Well, I think the doctor dialogue is going to be, it's a great educational opportunity because epilepsy has really changed a lot over the past, 5 or 10 years. Mm-hmm. There's been a big technology boom in that field, and I'm going to be focusing more on parenting tips for the children, parents who have children with epilepsy.
Sure.
And we're going to have Brian Smith, an adult epileptologist, and Kosta Elisevich, one of the adult epilepsy surgeons, neurosurgeon. And we're going to focus on just some educational tips for the community, basically from birth through adulthood.
When we talk about epilepsy, what are we talking about? What exactly is epilepsy? I think we all kind of have this vision in our mind of somebody having a really massive seizure, but that really is only a teeny little fraction.
It's a fraction, yeah. Most everyone has seen an example of a convulsion on television. Arms jerking, legs jerking, a very violent seizure. Those are easy to recognize. But, what's important for our parents to realize is that there are other types of seizures too. Sometimes they can be as simple as a brief staring spell or a behavioral arrest, unresponsive period, even for just 5 or 10 seconds. Now, these don't happen very commonly, but it's important for parents to realize that's a possibility. Sometimes these things aren't recognized until somebody's school's performance has declined, or maybe they're diagnosed with an attention difficulty, but they're not responding to medication. So there's a lot of things to keep an eye out for, and seizure types are very important for us. So they help dictate the workup that we're going to do for a child, maybe some treatment options, and they help us provide prognosis for the future. So
what's really nice for everyone to know is things are really changing here in West Michigan for patients and families that are dealing with epilepsy, and it is as simple as there's now support and there are now people here instead of having to get that elsewhere.
Yeah, I think even 1 or 2 years ago it wasn't very uncommon for higher level cases of epilepsy to have to travel across the state to the Detroit area or to Ann Arbor, or even across the state line to Cleveland Clinic to get their care or second opinion. But over the past year or two, we've made some advancements. We've taken some steps, and we're providing some of that care here now. And I think with future growth and development over the next year or two, we'll be providing most of that care here.
Well, with the Helen DeVos Children's Hospital, we're so blessed in this community because I'm guessing that when you have a child with epilepsy, there are some other big health concerns that can come along with that, and you have all those other specialties represented here as well.
Yeah, I think nowadays the key to successful treatment for epilepsy is a multidisciplinary approach. Luckily at Helen DeVos now we have a big group. We have a group of pediatric neurologists, nurses, medical assistants, a dietitian for our group for epilepsy, social workers. We have pediatric epileptologists, a specialist in epilepsy, and I think all of these team members really help provide good care for the kids.
What are the specific health concerns?
Well, I think there's other things to keep an eye out for if you have a child with epilepsy, and it can range from attention to concerns with learning disability. Some of our medications cause side effects, so there's side effects to keep an eye out for. So I think we'll be going over that at the talk and other things to keep an eye out for.
So let's talk about the doctor dialogue, because this is a great way to connect with people and with parents, with patients throughout the area. That's coming up Tuesday, March 27th.
Yeah, so I just think it's a great opportunity. As I mentioned, epilepsy has really changed over the past 5 or 10 years. So it's going to be a good opportunity just to educate on diagnosis, some of the management options, and what to keep an eye out for.
And I would think so too, with different ages, you have a young child, you have one that's a teenager, and the needs change too for families. And that's always a good resource to have people like you to talk to experts.
Definitely, yeah. There's always been a stigma associated with epilepsy, and nowadays, with all the advancements we've made in diagnosis and management, people with epilepsy can live relatively normal lives and be very prominent members of the society. So it's going to be great to educate the community about that.
Well, Dr. Arndt, thank you so much for being here with us today. And again, if you're interested in more information, that Dr. Dialogue coming up, and you can always get a hold of the specialists at the Helen DeVos Children's Hospital at their website as well. Thank you.
Yeah, thank you very much.
Thanks. We'll be right back.
This is 8 West.